Let's start with symptoms. What are the symptoms of histamine intolerance? So, as I was mentioning a minute ago, there are a lot of different breakdowns that we could take, but we're going to kind of break it down by system. So some people struggle with the classic allergy symptoms, the respiratory problems, the runny nose. Rhinorrhea is runny nose, rhinitis, which is inflammation, and then nasal congestion, dyspnea, which is shortness of breath. So the kind of classic symptoms around the face. Now we also might see watery, teary, itchy eyes. Those can also happen in this situation as well. So respiratory symptoms kind of clustered along that line. Then we have GI symptoms, and these are major. A lot of people don't think to correlate their gut and gut problems with histamines, but there are a number of different things that can happen. As you can see here, bloating and flatulence and fullness, like extreme fullness after a meal. I'm not talking about you stuffed yourself full and now you're full. I'm talking about, hey, I ate a little bit and I'm super full. Diarrhea can occur, abdominal pain, constipation. Notice the polar ends of this, diarrhea and or constipation, right? Nausea as well as vomiting can all be symptoms within your GI tract. We'll also sometimes see stomach pain, so a little bit higher up. So whereas abdominal pain, a little bit lower down, stomach pain a little bit higher up, kind of right below the sternal area. We'll sometimes see people manifest this pain. And the nervous system, one of the big ones is migraine headaches. So if you get migraines and you don't know why, you've tried all the medicines, you've tried all the different supplements, you've tried all the different diets, pay close attention tonight. We also see dizziness be a nervous system manifestation of histamine overload. And then we've got cardiovascular symptoms, rapid heart rate or tachycardia, hypotonia, as well as a collapse of the vascular tree or collapse of vessels. And then we see menstrual cramping. Also premenstrually, we'll see migraines. So migraines for some occur on kind of the timing is the question, right? So some people that have migraines, it's like, I don't know why, there's no rhyme or reason to the timing, but a lot of times we'll see women during the first week of their menstrual cycle suffer with severe migraine headache, and that can have to do with the hormone regulation of histamines, and we'll talk about that here in just a minute. And then we've got symptoms in the skin, pruritus, flushing, urticaria, dermatitis, and swelling are all possibilities. And we can put hives on this list as well, because that's a common term most of you are familiar with, so the outbreak of hives. So these are all, again, the symptoms that can manifest with histamine intolerance. And we're going to talk about why histamine intolerance happens in just a minute. But I want to go into a little bit more about histamines as a rule. So histamines, what are they? Like, what is a histamine exactly? So you should understand that the body produces histamine. So we make it. And histamine is a bioactive amine chemical. So it's a neurotransmitter. Histamine is a bioactive amine. So it helps the body relay messages. Just like dopamine is a neurotransmitter. Histamine, right? It's an amine neurotransmitter. And so what it does is it helps deliver chemical messages to different tissues throughout the body. So it's a messenger. And it's important that you understand, as we talk about high histamine tonight and the symptoms of high histamine and how that can be detrimental, that you don't get wrapped up into thinking that histamine is somehow bad or evil. It's not histamine that's the problem. We need histamine. Histamine keeps our brain alert. Histamine helps us to make stomach acid. So it's very important as a molecule, but it's also, in an abundant quantity, it can become a problem. So what you're looking at here in this diagram are the different types of histamine receptors. You've got what are called H1 and H2, H3, and H4 receptors. These are the different types of histamine receptors that will basically register histamine as it's floating through your body. So you see H1 receptors, you've got a lot of these in the lung tissue, and this is why you can get things like bronchoconstriction. It constricts the bronchioles, right, in your lungs, right, makes it hard to breathe or gives you shortness of breath. It also, you've got H1 receptors in a lot of other tissues. So, but you can see here, it's kind of systemic. We have H1 receptors throughout the body in a lot of different tissues. Predominantly our H2 receptors are in the stomach, as you can see here in the stomach, and this is important to understand. If you ever taken an H2 antagonist, these are medicines that block acid production, right? And so a lot of doctors give H2 blockers in essence to treat heartburn or gastric reflux, but no, when you do that, you're actually blocking your body's ability to produce hydrochloric acid. Hydrochloric acid is what we use as stomach acid, right? So it's what we use to basically break down proteins and digest our food. So it's important that if you're taking a drug that blocks H2 and blocks stomach acid, it's important to understand that because it's going to impact your digestion of protein, impact your digestion and absorption of nutrients like calcium and zinc and magnesium and selenium and vitamin A. So very important that you understand. So again, a lot of doctors will want to block these H2 receptors by giving you certain kinds of medicines. Then we have H3 receptors that are predominantly found in neurological tissue in the brain. So remember, histamine is a neurotransmitter. That's why if you've ever heard of an antihistamine, right, and I'm not talking about the H2 antagonists that doctors give to block stomach acid. I'm talking about drugs like Benadryl, right? These antihistamines, what do they do to people? A lot of times they make you sleepy. And it's because what is histamine? Histamine is a stimulant. It's a neurotransmitter that keeps your brain awake. And so when you block it, you actually block stimulation to the brain. That's why people that take antihistamines oftentimes get drowsy. That's why some people use antihistamines as a sleep aid. I don't necessarily recommend it in that way. There's a problem why you're not sleeping. But again, this is why when you block H3 receptors, you can get reduction in the production and the release of neurotransmitters that are important, like acetylcholine, serotonin, norepinephrine. You can develop sleep dysfunction or disorders, attention deficit disorder, epilepsy, and cognitive impairment, all linked to blocking the H3 receptor. And then we have the H4 receptors, and these are largely on our immune cells. And so these do things like regulate cancer, right? They regulate how your immune system behaves or responds to different things. So in my opinion, blocking any of these receptors for any length of time over long periods of time is a terrible idea because histamines are super critical and super important to maintain the function of these tissues. So again, I don't want to demonize histamine out of the gate. I want you to understand it's too much histamine that creates the problem. When you have too much histamine, you get an overproduction or an overstimulation of these tissues, and that can manifest as the symptoms that we just discussed. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below, and as always, thanks for tuning in.